So, a 25-year-old pregnant woman calls to learn about a vaccination she missed during her antenatal care visits. A 30-year-old man wants to know about the transmission of hepatitis B virus and its prevention. A 60-year-old father who just found out that he's diabetic calls to learn about actionable life modification steps that he needs to make. These are all real cases from the Dial Your Doctor service available in Ethiopia today. Now, Elias will take us to the other side of the continent, expressing and telling us about his experience of how similar technology is positively disrupting the relationship between providers and users in the world of commerce.
Lagos, Nigeria is one of our world's megacities. It's also home to the largest economy in Africa. You see here, this is a picture of Computer Village in downtown Ikeja. Earlier this week, I spent some time with Stanley and his 5 brothers. So you see, Stanley is very typical among young Nigerian graduates. He finished his degree in something like computer science and was desperate, looking for something to do. But he had limited formal work opportunities and limited working capital. So instead, he bought some watches and some cheap purses and started selling them online. Now, this kind of grew a bit. So he then started importing things using AliExpress, an Alibaba platform, and then reselling them online in Nigeria to the wider masses. It was so successful that he got his 5 brothers involved with their own online shops, all selling various brands to the wider public. You see here, he's in his living room. Now, one of his brothers is actually partially physically handicapped, but he's very content, like anybody else, working there, on his laptop with his mobile phones to his side. Stanley's achieved about a 50% margin on his products, which is impressive for anybody. And he does about 100 to 150 sales a week, right? So at his margins and basket size, already in his mid-20s, can be comfortably placed in the upper middle class of Nigeria. He's very pleased about that. His brothers told me, listen, e-commerce brings you global. And another said with a glee, I used to have to borrow money from my parents, now I can lend them money. In fact, there's this aura about being independent. And then in a very Nigeria way, soon we will be at the top. This story gives us hope. It gives us hope in Lagos and across the continent, where we see the demographic trend of the young, huge bulge of the young, and the challenge of the future will be to see if this youth bulge leads to prosperity and to innovation or perpetuates the cycle of poverty. Dr. Yohans and I believe that technology can transform this, starting with simple examples, as we saw with Stanley. But what are the common experiences in both health and commerce that makes technology an explosive catalyst for this growth? Why are we so hopeful?
Okay, let me take you back to Ethiopia, Africa's second largest country by population size, but where there is about 1 in 30,000 medical doctors, where geographic barriers are commonplace. You just have to think of the Seven Mountains, right? And transportation costs are inhibiting. Cultural barriers are rampant. We're harnessing the opportunity provided by the exponential expansion in ICT infrastructure by building a bridge to healthcare delivery and reinforcing the use and optimization of existing limited healthcare resources. We're very much aligned to the value and belief that Elias referenced. We believe that tech must empower, and it must empower for everybody. So let me talk a little bit about how we're doing this. We operate from the principle that combining advisory services, that is to say, allowing people to just make a simple phone call and talk to a doctor, with remote monitoring of patients, say TB patients or HIV patients, and making phone calls to check if they're taking their medication, if they're having side effects of it, or worsening of their disease condition, and linking that to existing on-the-ground health service providers, ambulance service providers, with pharmacies. This allows us to empower users to take a more active role in managing their health and the health of their loved ones. So what have we been learning? And how is this being embraced here? After analyzing about 3,000 confidential and anonymous call records over a period of 9 months, we have learned that Ethiopians are underserved in the obvious, like service during off hours, in the rural parts of the country, but in critical healthcare areas, in maternal and child health, and most significantly, in socially stigmatized and taboo health topics. And these socially stigmatized and taboo health topics, you can guess them: sexuality, sexual disorders, sexually transmitted diseases, or even mental health. Issues that do not as much come up in daily face-to-face medical practice. I'd like to give you some data that we're presenting for the first time now about who's adopting this early iteration of leapfrog technology. So when we look at our users, the majority of our callers are young people between the ages of 20 and 40. But we've had calls from people aged 5 days to 90 years. But an interesting finding is that 1 out of 6 of our calls are about children below the age of 5, a very important age group, because healthcare interventions in that age group are very critical because of their because they are very vulnerable compared to the general population. Then, although the majority of our calls are from the city centers, we get calls from all over Ethiopia. Actually, a quarter of our calls are from very rural parts of Ethiopia, as far as Holete or Gimbi or Humera. And this truly demonstrates the power of new tech in extending reach to the most underserved and allowing them access as middle-class urban dwellers. When we look at the gender divide between our users, it's almost similar. But an interesting fact is that equal numbers of women and men call about neonatal and child health issues. Now, this is maybe a sideline to this, but this could suggest that given the opportunity, Ethiopian men are happy to take more of an active role in early child care than usually imagined. So, like Elias's story of the transformation of the young and underserved in Nigeria, we have already started seeing the beginnings of the revolution in healthcare today, and the access that's coming because of similar liberalization of information due to technology.
I work in the world of developing world online marketplaces. Okay? Alongside our health partners, we believe that our fundamental aim is to democratize commerce. Along the way, we're democratizing health. So we cover about 16 markets across over 600 million people. Similar to our friends at eBay or Alibaba or Mercado Libre, the idea is to fundamentally disrupt the relationship between supply and demand, between provider, supplier, and consumer. We believe that fundamentally this sort of opportunity of about $900 billion in consumer spending in Africa should be addressed in a different way, in a way that creates opportunities for this youth bulge. In fact, we want to leapfrog from traditional brick and mortar institutions and their associated weaknesses, which is the natural infrastructure, rent, generators, to places like Stanley's living room. And we intend to do that through technology and the internet. And we see no reason why 50 euros and a good 3G connection, which occasionally now is available in Addis, can't propel you to opportunities beyond your tenure. If the 1990s was about democratizing politics in Africa, as some of you may have heard, we believe that the 2010s is about democratizing health and commerce. So what I'm showing here has actually also never been shown before. I had to request permission to release it. And this just shows the current, on one particular platform, our platform, how the distribution of sellers are, right? So naturally, the most are in Nigeria with about 10,000. But across the continent, there are almost 40,000 sellers, right? But really interestingly, that number has actually tripled in the last 3 months. So there's just exponential growth. And despite the virtual nature of what you may see here, or what you may kind of hear me saying, it's very much flesh and blood. So it's not just about people magically signing up. We actually go, and many of the different similar platforms go and talk to and recruit and train and explain how these marketplaces work to the young, hungry SME class. In fact, there's some members working on the same project in this room today. And what we're finding is irrefutable, is that there's a growing and very earnest hunger among those whose experiences with the web may have been limited, but who have the same hunger to achieve, to take the 170 million plus internet users and grasp for themselves what was limited before due to their socioeconomic position or limited access to formal channels. As we heard about microfinance, if we believe that microfinance and now the missing middle access is transforming how many of us are first taking that step out of poverty and into the middle class and above, we fundamentally believe that e-commerce offers a platform to have hungry SME class access new pockets of demand and opportunity. These pockets of opportunity come where price, naturally, and a spirit of hustle is much more important than pedigree or position. And there's no greater place where this unjust divide based upon legacy is more explicit than in the world of health, and that's changing today.
So, as Elias said, if we're already seeing the cracks in the tyranny and monopoly of information and access
today already, what's the next piece of the puzzle that's going to drive the following phase of revolution, so to speak? In healthcare, just like e-commerce, we're going from connection, that is providing people with the knowledge to challenge existing practices and make better healthcare and purchasing choices, to centralized regulation. By this, I mean application of smart decision support systems, software that uses best practice clinical protocols to help medical professionals make their decisions. This standardizes and self-regulates medical care. The next leap is going to be into automation. That is harnessing next-generation cognitive computing capabilities to have consumer-facing products and services. So let me talk a little bit about how we anticipate, at least in the healthcare sphere, this movement is going to trend in the coming 5 years. We are already starting to see, and we're going to see more of it, deployment of systems like Isabella in the US. These are smart decision support systems that guide medical professionals through algorithms so that they make better decisions and remove errors. We might go through that or altogether make the leap into automation. And a great example of this is projects being done in partnership with IBM's supercomputer Watson. So people are using their natural language to interact with a supercomputer and getting evidence-based real-time diagnosis and medical advice. So it's not very hard to imagine a Uganda or Ghana tomorrow, where a rural farmer, miles away from anything resembling a town, is able to get the same quality of medical advice as a middle-class American in Chicago. He would be able to call or go on the internet and ask questions on behalf of his 5-year-old daughter and interact with this all-knowing medical knowledge aggregator supercomputer in his natural local language and get immediate evidence-based diagnostic from which the case can be treated or trashed. This is a major step in the movement which Elias has already been talking about and encompasses commerce and concurrently translates technology into universal access and equity.
As the good doctor's already said, this revolution is happening now, today. We're seeing parts of it come out. But the reality is that in the future, we'll see an irreversible shift, and this will come in the next 5 years. So in our field, in e-commerce, we look to recent events. Many of you heard about the recent IPO of Alibaba, now worth over $200 billion, and the success of Jack Ma. So Alibaba runs a platform called Taobao, which is like eBay. Taobao has been credited with creating hundreds of thousands of jobs in China. In fact, there's one study that says in 2012, e-commerce in China created 2 million jobs and over 12 million indirectly. It's not bad for a country 3 decades ago known for state-run inefficiency only. Now, if we take it back to Nigeria, for example, talking about a country, largest economy in Africa, with 30% of Africa's internet users and 35% of its GDP, it's not unthinkable to imagine a future, perhaps by 2030, where the majority of Nigeria's middle class is purchasing the majority of their non-food items already online. McKinsey estimates that by 2030, there will be about a $1.4 trillion consumer market in Nigeria. It's massive, right? So now if 20% of that was put, or let's say eligible to be put online, and then 20% of that actually went online, we're talking about enough opportunity to create at least 500,000 jobs and sustain another 2.5 million people. But why is this so meaningful? Why does this shift really matter for us today? Why does the democratization of health and commerce matter to everyone in this room? So we see in a continent with a GDP of about $2.6 trillion by 2020, but about 1.1 billion Africans in working age population by 2040, we have a shared mandate to leverage technology to engage the entrepreneurial spirit of this generation. We must align the ambitions of each and every one of us, the ambitions for choice that we have, with the opportunities that we should give. And in a world growing increasingly unequal, in part actually driven by some of the gains in technology, we believe that e-commerce and m-health, at least in Africa, is one very, very clear area where we can actually very much level versus steepen the playing field. Our friends like Stanley in Nigeria or the Good Doctors farmers in Uganda and Ghana are part of this revolution that sustains and changes for the future.
And what does it matter to you, people here listening today? How do we set the pace together in this progressive revolution? Policymakers, business leaders, academics, NGO workers, there's a lot of people here today. All the ingredients needed to construct the policies and build the infrastructure to propel this shift meaningfully in Ethiopia. All the virtual abilities that myself and Elias talked about, that we have just discussed, are contingent upon basic brick-and-mortar institutions, an educated populace, mobile and internet penetration, enabling commercial policies, and efficient distribution channels. So it's Elias's and my request and earnest hope that you not only allow, but encourage purposeful actions that support the next wave of development in health and commerce. And in doing so, ensure that Ethiopia's and Africa's story of potential is a path to reality. Thank you.